Why does bone conduction testing bypass the middle ear? Imagine trying to listen to music through a wall. If the wall is damaged or blocked, the sound can't get through easily. That's similar to what happens in hearing loss caused by issues in the outer or middle ear. Bone conduction testing is a clever way to see how well your inner ear, or cochlea, is working, without the outer or middle ear getting in the way. Normally, when you hear sounds through air conduction, sound waves enter your ear canal, vibrate your eardrum, and then travel through tiny bones in your middle ear called ossicles. These bones pass the vibrations to the cochlea, which turns them into signals your brain understands. But if there's damage or blockage in the outer ear or middle ear, like earwax buildup, infections, or a broken eardrum, this pathway gets disrupted. That causes what we call conductive hearing loss, where sound can't travel properly through these structures. Bone conduction testing works differently. Instead of sending sound waves through the air, a small device called a vibrator is placed on your skull, usually behind the ear. This device sends vibrations directly through the bones of your skull to your cochlea. Because the vibrations bypass the outer and middle ear entirely, they reach the inner ear directly. This means the test can tell us if your cochlea and auditory nerve are working properly, regardless of any problems in the outer or middle ear. This is why bone conduction testing is so useful. If your bone conduction thresholds are normal but your air conduction thresholds are poor, it indicates a conductive hearing loss. The problem is in the outer or middle ear, not your inner ear. But if both bone and air conduction thresholds are elevated, it suggests sensory neural hearing loss, which involves the inner ear or auditory nerve. Hearing aids and implants also use this principle. Devices like bone conduction hearing aids send vibrations directly to the cochlea, bypassing damaged outer or middle ear parts. This helps people with conductive or mixed hearing loss hear more clearly by skipping the faulty conduction pathway altogether. In essence, bone conduction testing bypasses the middle ear because it uses vibrations transmitted through the skull bones directly to the cochlea. This method provides a clear picture of inner ear health, independent of any outer or middle ear issues. It's a vital tool in audiology, helping healthcare professionals diagnose the type and cause of hearing loss accurately. Always remember, if you have concerns about your hearing, consult a qualified audiologist or healthcare provider for personalized advice and testing.